You know that feeling when everything just clicks? Your mind is sharp, your mood is steady, your body feels like it's firing on all cylinders. That's not luck, that's what your body is capable of every single day. Now, I've looked into a lot of fish oil supplements, and honestly, most of them are mystery sourced, overprocessed, blasted with heat, and packed with synthetic add-ins. But this one is different. Omega-3 Rejuvenate from Big Bold Health starts with wild Alaskan salmon and cod, sustainably caught from some of the cleanest waters on the planet, and then it's processed at low temperatures to preserve what actually matters. We're talking about real omega-3s, naturally occurring vitamins A and D, and pro-resolving mediators, or PRMs, that help your body balance its own immune response. What does that mean for you? Clearer thinking, more stable mood, and real nature-based support for your heart and immune system. No shortcuts, no synthetic nonsense. And it was developed by Dr. Jeffrey Bland, a true pioneer in the world of complementary health. If you want to feel the difference, go to bigboldhealth.com/Hoffman. That's bigboldhealth.com/Hoffman and use code Hoffman for 20% off site-wide. Once you feel it, you'll know. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. It's part 2 of our podcast for today. And the way it works is you send questions to us, questions@drhoffman.net. It's called Q&A with Leyla. With me today, Leyla Muden, who is our nutritionist in residence. And Leyla, you also, and tell us a little bit about your practice, because you practice independently.
Yes, I do. I maintain a private practice here in Manhattan. I'm available in person. I'm available via telephone, via telehealth. If you're interested, just call the number 212-779-1744. Leave me a message there and I will get back to you about setting up an appointment. Yeah.
Yeah, great. Because, you know, as you can certainly see, Leyla embodies the spirit of intelligent medicine. All right. Let's get to our next question. It's an interesting question. So,
yeah. This is actually from Betty. Hi, Dr. Hoffman and Leyla. I'm wondering about high blood pressure being genetic. As my sister went through a valve replacement, she was told that some of her heart issues could be genetic and possibly affect other siblings. And if so, what can we do about it? Are we stuck taking BP meds? I do most things right for this issue, but my blood pressure is always high, sometimes in the 180/100, but most times it's far less than that. I'm in my early 70s. I feel great. I'm healthy. No problems.
Okay. So let's talk about genetics a little bit. There are certain things that are really straightforward genetic diseases, like sickle cell anemia, which involves, there are two forms. There's, since you have kind of two sets of genes that determine an outcome, if you get one hit, you might not even know you have a condition like sickle cell, but some who have just one hit, they may, under conditions of extreme stress or altitude, have some problems. But folks who have a double hit, getting it from both parents, they have, terrible sickling of their blood, sickling crises, and it's a big mess. So that is a clear-cut example of a genetic disease. It's either you don't have it or, you have a hidden potential for it. You can transmit it, but you won't notice it, or you are out of luck. But the vast majority of conditions are determined by multiple genes conspiring together to give you a genetic susceptibility, which is not usually deterministic. In other words, so even one of the couple of the worst ones, the BRCA gene for breast cancer, it's not 100%. It just increases your chances of breast cancer many-fold. The same thing with the ApoE4 gene for Alzheimer's, the so-called Alzheimer's gene. There are people with the ApoE4 gene who don't develop it. Now, that's where nature versus nurture comes in, okay? And we know that lifestyle makes a big difference, even if you have a genetic susceptibility. So, obesity is an example. There are components that create susceptibility to obesity within families, and even within ethnicities.
Right.
And
Right.
however,
Diabetes as well.
lifestyle can trump that. So an example of which is the Southeast Native Americans in the United States, who, when first discovered by the conquistadors, in the 1500s and 1600s, they have pictures of these lean, healthy, magnificent looking indigenous people. And then fast forward to 2026, the 21st century, we have like 80-90% incidence of diabetes among the Navajos and descendants of the Apaches, once proud warrior nation. And that's the effect of environment. So high susceptibility to obesity and diabetes, but they have what's called the thrifty genes which are great if you're subject to famine, starvation, and desert privation, but under the influence of ultra-processed foods, sedentary lifestyle, alcohol, then you're going to be in trouble. So when it comes to hypertension is one of those things. And so there are probably not that many forms of hypertension where it's almost unavoidable that someone's going to get hypertension. That would be the rarity among genetic susceptibilities to hypertension. And mostly that can be overcome with lifestyle, which includes diet, exercise, sleep, stress reduction,
all of that,
et cetera. For some people, they're sodium sensitive, but for the majority of people, it's not about sodium.
No.
And it's more about sodium potassium ratio. All that stuff, right?
All of that. Insulin resistance is another one because that makes our body hold on to more sodium, which then increases the law of diffusion. Water follows the salt into our bloodstream, increases the blood volume, high blood pressure. There it is. So it's like the genes are the gun, but it's the lifestyle that pulls the trigger.
Exactly.
The gun could just sit there.
Right. It's a potential.
Happens.
It's a potential.
Yeah, exactly.
Yeah.
I'll tell many people, diabetes is in my family. I know I'm going to get diabetes no matter what. No, it's not. They ate in a way to support being as carbohydrate intolerant as they became, which is what diabetes is. You don't have to eat that way and you will never get diabetes, at least not on my watch. So it's that kind of a thing. And I just want to say to Betty says she's in her early 70s. She feels great and is healthy. She should monitor her blood pressure at home, but it varies so much. But losing as little as 5 to 7% of your weight can bring down blood
we
pressure.
don't know what her height and weight is. We don't know.
We don't know that. We don't know what that is, Betty. So we're just making an assumption here that you're not underweight, for example. So
this is one of the things that we see in Western societies is there's a tendency for almost the majority of people to have hypertension or rising blood pressure as they age. By the time people are 60 or 65, I think the statistics show that roughly half the population is on blood pressure medication, or more. I mean, you socialize, and sometimes you meet people who are our peers in age, and many are taking blood pressure medication.
Yeah.
So I don't. You don't. So it is thought that it is simply hardening of the arteries. And there is something about that, is that the arteries lose flexibility as you age. And so there is something that is almost indefatigable from lifestyle that makes people more prone to inelastic arteries as they age. Just as your skin loses tone and so on, you're going to have arterial inelasticity, so-called hardening of the arteries. However, I put my anthropologist hat on. I studied primitive societies, and in primitive societies, there's a high mortality risk because the conditions are daunting. And so there's not a lot of people who reach their 70s and 80s, but there are some. And if you put your pith helmet on and you go to the remote parts of the world which have been untouched by Western civilization, which are much fewer and further between than they ever have been, you will see very old adults who are non-hypertensive, and there is not, we don't see that curve that keeps ascending in terms of blood pressure that's associated with age. So it is not inevitable. But then again, are you going to eat like, a Amazon Indian in a remote tribe? Are you going to subsist that way, and, climb trees and, shoot monkeys with blow darts and, it's hard to replicate their lifestyle voluntarily,
Yeah, exactly. Exactly. So Betty, don't fret, take some magnesium as well. Maybe you could be low in magnesium. Your cortisol might be too high. There are many other reasons. A full workup is always recommended to, wow.
Might it be time?
More people.
I'm sorry.
Yeah.
I was going to say, no, might it be time to share an important message with our listeners, one of our sponsors?
It is time.
All right. It's always a good time. All right. So here goes. Listen up. You know that feeling. You're exhausted, but your brain just won't quit. You're staring at the ceiling, watching the clock, dreading the morning. Here's something that actually helps. It's called Kyolic Specialty Series Sleep Mushrooms Plus. And it's unlike anything you've tried before. This isn't some chemical sleep aid that leaves you foggy and dragging the next day. This is a clean botanical formula built around certified organic reishi mushrooms grown on real farms, not in a lab, combined with valerian root to help you fall asleep faster and stay asleep longer, L-theanine to quiet that racing mind, and Kyolic Age Garlic Extract, one of the most trusted wellness ingredients available for circulation and stress support. It's vegan, non-GMO, no gluten, no dairy, no artificial anything. Just 2 capsules, 2 hours before bed, and you wake up actually rested, not groggy, not out of it, just refreshed. Kyolic Sleep Mushrooms Plus from Wakanaga. Learn more about this and the entire Kyolic Mushrooms Plus line at kyolic.com. That's KYOLIC.com. Look for Kyolic at natural health stores nationwide and online. Thanks for listening. Thanks for supporting our sponsors. Of course, they are what make intelligent medicine a continuing free resource to you. And now let's continue with questions and comments.
Okay, this is from Judy. Hi, Dr. Hoffman and Leyla. I heard there was a study that said exceeding 1 gram of omega-3s daily elevates the risk of atrial fibrillation, especially in older adults. Have you heard of this?
Yeah, so I initially heard of this and saw the studies, and I said, let's keep our powder dry because it just didn't seem that plausible. And in fact, there are studies that show that consumption of omega-3 fatty acids reduces the incidence of another type of heart arrhythmia, which is ventricular arrhythmia, which is actually, the kind of thing that you see on the doctor shows, like, get the paddles out, it's VTAC, ventricular tachycardia. So higher levels of omega-3 somewhat protect against, in effect, sudden death, because VTAC is synonymous with sudden death. That's how people drop dead. So, but then they say, well, but this is a different kind of thing because it's not the ventricle, it's the atrium, a different part of the heart. So I said, well, I'm going to sit on this for a while. I originally wrote an article about it. I said the study was methodologically weak. I said, let's hold our fire on this one before we scare people. But the conventional medical establishment didn't hold back, and they started saying, don't take fish oil. It's dangerous. You might get atrial fibrillation. So you're aware of how this progressed, right?
Yes. In fact, there is an article. This is recent. This is Journal of the American Heart Association, 2025, December. Associations between plasma omega-3 and fish oil use with risk of AFib in the UK Biobank. So
wait, how many people did they look at? Because that's a very gigantic study.
What they did, it was about random sample of 261,108.
Wow.
And even more, 466,169 reported fish oil use. And primary outcome, they looked at all that. This is
we're saying supplemental use, not fish.
Supplemental, supplemental use.
Okay.
Yeah. And the result is plasma omega-3 levels were inversely associated with incident atrial fibrillation. So fish oil use.
In other words, the higher their levels of omega-3, the less likely they were to have atrial. Okay.
Yeah.
Okay.
Yeah.
So here's another question. Let's say you already have atrial fibrillation. So a lot of people took this to mean like, I have atrial fibrillation, I shouldn't take fish oil. But if you already have atrial fibrillation, and you're going to be controlled with medication, or you're going to be a subject for cardioversion, which is done with, they zap you, or you're going to get what's called an ablation, to fix it. So you have three options, and mostly it's like learn to live with it, take a medication to keep your heart from racing, and it'll be fine. It's like, atrial fibrillation in the over 75 population is kind of like acne on teenagers. It is so prevalent, and people live with it. It is really common. So then they say, well, atrial fibrillation and fish oil, I better stop taking my fish oil. Fish oil is precisely the thing you need to take if you have atrial fibrillation.
Absolutely.
Because you already have atrial fibrillation. What's going to give you atrial fibrillation? Even if it were to give you atrial fibrillation, you already have atrial fibrillation. And what you need is anticoagulation. In fact, if you have atrial fibrillation, you're already going to be on anticoagulants. And it's actually, people will say, well, yeah, but I'm already on an anticoagulant. I don't need fish oil. It'll make me start, I'll bleed to death. It actually has been shown that combining most of the anticoagulants with fish oil, you have actually reduced incidence of harmful bleeding episodes.
Wow.
So fascinating. Really turns out that when it comes to anticoagulation, there's two elements. One is antithrombotic effect, preventing blood clots. And then there's also bleeding time. And there's actually different.
They are.
But most of the medications cause you to bleed more, like Coumadin certainly causes you to bleed more. But if you're on, these other, what are some of the other medications that you're seeing patients taking
Plavix.
now? Plavix. Not Plavix. Plavix is a blood thinner, but
it's a blood thinner.
Whatever.
Starts with an E. Okay. Starts with a P. Anyway, the conclusion of this study, while we're trying to think of the medication for you and I, they conclude that higher circulating omega-3 levels were linked to reduced AFib risk in the UK Biobank. And further, after age was adjusted for as a continuous variable, no association was found between fish oil use and risk for atrial fibrillation.
Okay.
So, this is the most recent from last December.
And I think one could say, but there's some signs that it could increase it. So this is, but when you see, and especially in the field of nutrition, when you see a study that says, this is bad, this is good, this is, it suggests that the effect is of such a small magnitude that it's insignificant. That it just depends on how you gather and interpret the data, and therefore you cannot base any conclusions on that.
Pradaxa.
Thank you. So what I was going to say is that those drugs both increase bleeding time and they also reduce blood clots, which the desired effect is reducing blood clots, but the undesirable effect is increasing bleeding time. Fish oil tends to be more antithrombotic than increasing bleeding time. So that's why it is actually fine to accompany your, I would prescribe it, for people. And, look, there's certain people who say, I took the fish oil along with my Plavix, my aspirin, you name it, and I got more bruising. Okay, fine. So back off.
Back off the aspirin, maybe back off the, please do this with the supervision of your doctor.
They actually,
because we said so on podcast.
This is in the news recently, is that they had that physical with Trump, which I wasn't entirely happy with, because they said, he's perfectly healthy. Oh, he gained 14 pounds. Well, he's perfectly healthy. Like, what does he weigh? 237 pounds? That's not great. But they also, what they did is they backed off on his aspirin because they gave him like a kind of one-size-fits-all dose of aspirin. And apparently he's very sensitive to aspirin. And people were noticing in the picture, like they hold him under a microscope and they say, oh my God, he's got, he's checking out. Look at his hands. They're all bruised. Well, he does a lot of glad handing, a lot of handshaking.
True.
And his hands were becoming bruised because the aspirin was thinning his blood too much.
Oh, okay.
So I think that's one of the things that they tweaked
They lean back on it.
at Bethesda, wherever Johns Hopkins or wherever they do those presidential
Right.
physicals.
Yeah.
But anyway,
Okay. All right. Judy sends us such thoughtful questions. Thank you so much. We always look forward to
keep them
them.
coming, Judy.
Yeah, absolutely. Oh, here's one from Lori. Lori is also 70 years old. Okay. Hello. I have gotten strep throat 3 times in 2 months. I take care of children.
Right.
An infectious disease doctor ordered another month of Pen-VK after all the symptoms were gone. What can I do to reinvigorate my microbiome? And what can I do to prevent getting more strep?
Okay. So my feeling, my impression is that she had incompletely eradicated strep, and that it's not like she keeps catching it from the kid. The kid's giving it back and back. It's like ping-ponging from the kid. She acquired it maybe from the kid, probably from the kid, because kids often have strep throats. So why even treat strep throats? Why bother? Why not just take some herbs? Don't make such a big deal out of it. It's just a sore throat. Well, strep can cause endocarditis. And that's why, I used to have, when I was in my medical training in the 80s, I remember I had a medical service. My patients, on average, were 85-year-old females from the Bronx with congestive heart failure. What was going on? Like, all these females were having congestive heart failure. What they were from a generation pre-penicillin, whereas children, they acquired a penicillin infection, which caused a rheumatic heart disease, an infection of the heart valves, which damaged their heart valves. And then they became prone later in life to congestive heart failure.
Rheumatic fever is that?
Yeah, and I actually have, this is kind of tragic because I know actually it's a friend of mine who's a nurse, but she's very holistic, and her child had strep throat, and she didn't want to treat it, and ultimately the kid developed rheumatic heart disease, had to be on antibiotics for a year to eradicate it. So, it's kind of, that's why they test for strep. They have these rapid strep tests.
Yeah.
It's more of a pediatric thing in older adults, less common. Could it cause rheumatic heart disease in a 70-something-year-old? I don't know. It's more of a childhood disease or a young person's disease.
Yeah.
But, look, the deal. When people get repeat infections, it's not necessarily the pathogen, it's the terrain.
It's the terrain.
Yeah.
Yes.
So let's talk about, how to bolster immunity.
Yeah. Yeah. Well, the gut-associated lymphoid tissue, that's our gut. Good health begins in the gut. 70 to 80% of our immune system is operating from there. The GALT, gut-associated lymphoid tissue, GALT. And you need to keep your microbiome healthy, all of that.
Because there's a lot of signaling to your immune system from these, a lot of your immune system is located in the gut, and the microbes within your gut actually may signal a healthy immune response or an unhealthy immune response.
Exactly. And the antibiotics, unfortunately, are a bit of a double-edged sword. They do a great job of wiping out the bad bacteria, but they also wipe out the good bacteria, leaving opportunistic bacteria a chance to proliferate. And that's what you don't want for a healthy immune system. You want to eat a very clean diet. A lot of sugar actually suppresses immunity.
Yeah, you can actually see the white blood cells becoming paralyzed under a microscope when there's a high blood sugar.
Yes, exactly. So there is that. Make sure that, I guess appropriate hand washing, all of that, but eating a very clean diet, making sure you get a good night's restful sleep, that you're waking up most mornings rested, refreshed, getting ample amounts of exercise, getting sunshine. Make sure you've got a lot of vitamin D.
Sure.
Make sure you've got ample serum vitamin D. You want it above 55. You don't want it over 100. So if you're not taking a supplement, Lori, we recommend you take a supplement. Lori is 70. What happens after the age of about 65 is we don't have as much 7-dehydrocholesterol under our skin to react with the UVB rays of the sun to then produce vitamin D. As we get older, that kind of goes away.
She should get her vitamin D levels checked.
Yes, she should get it checked. So even if you are out in the sun, you should probably still take a vitamin D supplement.
Sure.
Make sure there's vitamin K in there. You want vitamin K with your vitamin D, as a matter of course.
So other immune stimulating things, cordyceps,
vitamin C,
beta glucan, vitamin C, the mushroom derived things. Yeah.
All of that.
Those are good.
I like EGCG as well.
Natural olive leaf is a natural antibacterial.
And if you had to, oil of oregano or oregacillin.
Gargle, because it's located in the throat,
Yeah, that could be something. So these are the ways to keep yourself well. All right.
But, again, one of the things that I would do is, you can have an immune profile, and you can actually determine if a person has low immunity through various tests. Testing the B cells and testing I won't get into the technicalities of that, but if you get chronic repeated infections, it is worthwhile asking your doctor or see an immunologist who specializes in immunity to screen you to see if you have an appropriate immune response. And it has to do with IgG and IgM and IgA. But I think starting with the gut is a good place to start.
Yeah. And Lori was also asking, taking a probiotic certainly is helpful. It's a place to start. Eating probiotic foods, sauerkraut, kimchi, maybe some kefir. If you're not having, it could be a coconut milk kefir if you're dairy sensitive. For example, lactic acid, fermented pickles, things like that. All this fermentation is very helpful. When you take cabbage and you ferment it to make sauerkraut, you're actually increasing the vitamin C by 10-fold, believe it or not, but just by fermenting it. So the fermentation of these foods, it's absolutely wonderful. Yeah.
Dr. O'Hara's, just to mention one of our sponsors, they make Essential Formula, which is a great product. It's a pre and a pro and a postbiotic in a capsule. But what they've decided to do is kind of interesting. They decided to just make a postbiotic paste that is, or I guess a liquidy thing that comes in a sachet, which confers the benefits of these postbiotics, which actually have some real immune regulating effects. And if you want to replenish your gut, this is something that you may want to look into in your clinical practice, is people who, or you want to restore the gut, fine, take Dr. Here's Essential Formula, but instead of taking, 6 or 8 capsules, just take them, a couple of capsules and then take some of the postbiotic paste. It's a new product from Essential Formulas. And they're just rolling it out. And we just did a podcast on that subject.
Thank you. So love the clinical pearls in my profession. Absolutely. Thank you.
Always
for that,
something new. But, the next conference you attend, you'll probably see, at their booth, they're going to have a lot of fanfare about the rollout of that new product.
Terrific. Lori, thank you very much for your question. All right.
I think we have time for just one additional question. If we have something in the mailbox, do we have something?
Yeah, we do actually, from Carol. Recently, there was a discussion on your podcast regarding the proliferation of added protein to various common foods.
Yeah.
It might be peculiar to my system, but both times that I've eaten a small portion of these types of foods, I've had 2 days of queasy digestive symptoms. One was a protein added to yogurt, and the other was a protein added waffle.
Right.
Also, by the way, Dr. Hoffman, Carol also says, I've been to several of the countries Dr. Hoffman mentioned on his recent vacation, but the Viking cruise interested me. They are sold out until 2028.
All right.
Yeah,
it's a popular cruise. Scandinavia and the Baltics. So
these protein added foods.
So here's the thing, if you, all right, there's 2 ways to get a concentrated protein product. There's 3 ways. One is to just eat protein, like eat meat, or eat soy. That's pretty concentrated. And, that's one way to get your protein. Have eggs, right? Okay.
Yeah.
The other is to take foods where the protein is concentrated. So an example, which is Greek yogurt, it's processed in such a way that it concentrates the protein there. So it actually, that augments the protein content it's kind of an enhanced yogurt where, a thin watery yogurt isn't going to have as much protein, but you could stick a spoon into Greek yogurt, it's going to stand up. Right? And the other way you can enhance the protein is to add ultra-processed protein to a product. Yeah. Now, that may not be that digestible because it's really not that natural. No. And there are various ways that they can derive that protein, and it may not be the highest quality protein, and it may be protein that is difficult to digest. And so, you can get high protein, I don't know, I think they tried high protein Oreos at one point. They abandoned it.
No.
Yeah. So you can get high protein bread, you can get high protein yogurt,
cereal.
You can bars,
pancake.
You name everything.
High protein. Yeah.
So, but what they're adding is sort of cheap processed protein that may or may not have desirable characteristics in terms of digestibility.
And that could be the reason, Carol, that you're having these queasy digestive symptoms.
The other reason is that, frankly, older people, especially women, develop a loss of the ability to digest and assimilate protein. And the reason that women have this more is women have less muscles than men. Yeah. And so they actually have less digestive enzymes to begin with to digest protein. And then as they age, the attrition is more pronounced in women because they're starting out from already a little bit of a compromised protein digestion ability, whereas men have a head start.
Yeah, and add to that the lack of appetite that can also occur as we get older. I'm talking quite elderly now, where you just want a piece of toast and a cup of tea when you really should be having a steak or a nice piece of fish or something instead of that. So
consider digestive enzymes that might actually help, and look for digestive enzymes that attack protein. Yeah.
And Carol, avoid these protein-added foods. Just eat some good quality protein. Eat real food.
They're highly processed. They have kind of a health halo because protein is in vogue now. And so anything that it says to be enriched with protein appears to have added value. But it is, it's better to just go to original unprocessed foods for your sources of protein.
Absolutely.
Yeah.
Absolutely. Yeah. So thank you for that. Okay. And just to remind everybody, questions at drhoffman.net. That is questions at drhoffman.net. And you could shop hundreds of curated vetted supplements in Dr. Hoffman's full script dispensary. We stock only the highest quality supplements, some of which are very hard to find elsewhere. The very same supplements he recommends he takes himself as well as I take them myself too. Through Full Script, you can access his custom protocols that combine different products that he recommends for your specific health goals. So remember, go to drhoffmanstore.com. That is drhoffmanstore.com.
Well, thank you for that. And thanks for joining us today, Leyla. I think it was the most interesting and informative discussion.
Yes, always fun. We love your questions and look forward to them.
Once again, questions at drhoffman.net. Also, that includes comments. Happy to receive them. And until next week, this is our Q&A with Leyla, Intelligent Medicine, drhoffman.com. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything Intelligent Medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations.
This is Leyla Muden, registered dietitian nutritionist. I maintain a private practice and see patients regularly. If you require a nutrition consult with me but live out of town, there's no need to travel to New York City. I have telephone and telehealth consultations with clients from all over the country. Please visit drhoffman.com for more information. And to set up an appointment, call 212-779-1744. That's 212-779-1744. I look forward to being a collaborator in your healthcare.